patients to give us the resources we need to support our work. We've asked for specifics, and nothing being presented is supporting that claim. If UCSF really wanted to share resources and improve patient access, they could be doing that already. We have a very diverse population here with very unique needs. The most important resource that we're lacking, the one that cannot be guaranteed, is more staff, more providers, more people to give the specialized care that our patients need. In my department, we've worked hard over the years in bargaining sessions to create a very competitive contract with NUHW. Despite that contract, we're still unable to hire. We've had an open position for the last couple years. We have over 1,400 kids waiting to get in to see us, and our next opening is in late October. UCSF recruiter told us there are almost as many open positions for audiologists in the Bay as there are licensed professionals, meaning that the few people who are searching for a job are looking for competitive offers. This proposed integration is going to lead to a lower wage scale and more expensive benefits, making it even harder and further decreasing our chance to hire. Our patients deserve better. Our staff deserves better. We are not replaceable. At the bargaining table, we've been told for years our hospital would remain affiliated but separate. Now UCSF is going back on their words, and they're keeping Oakland Children separate and licensed only. During yesterday's bargaining session, hospital representatives acknowledged that we have fundamentally different perspectives, and yet they refuse to proceed with arbitration to settle our grievances. It was stated that it's management's right to make this unilateral decision, and it's legal because they've done it before. But just because you've gotten away with it once doesn't make it legal, doesn't make it ethical. And you know what? Workers have rights too. Our employees have hundreds of stories and examples of how this integration would negatively impact our lives. To those, I encourage each and every one of you to speak to each other. Speak to the community, keep talking, keep questioning, keep fighting. We deserve to be heard. Our patients deserve the best quality of care we can provide. To UCSF, do better. Honor our voices, honor our expertise, honor the years that we have devoted to this institution, honor workers' rights, and our choice to maintain our NUHW representation. We have voted for them, and we will continue to fight for what's right. Thank you.
Wendy Bloom.
Are you a nurse?
Yes, I'm already 38 years at Children's Hospital in Oakland.
And what's going on today, May Day? Trump has said he wants to get rid of Medicaid. He wants to destroy a lot of programs. How is that going to affect you and other nurses and your patients?
At Children's Hospital, even though it's a private nonprofit, we're associated with UCSF. Our patients, we have a huge population that's on Medi-Cal, so obviously that would have a huge impact on our funding, and it could harm our patients and our programs. And our staffing. I mean, everything is connected. I mean, the things they're doing to public health, cutting back on research. I take care of kids with cancer. They want to cut, research on new drugs for kids with cancer. They're slowing down vaccine development. That was a new one that RFK came out with. All of that hurts our patients and our community.
The UC regents and management apparently are attacking the workers. They spend millions of dollars on your...
Children's is UCSF Benioff, Oakland, and they are about to merge us fully with the hospital, and our contract, they want to merge our union contract, CNA, at the hospital, which is over 80 years old, into the UC contract, which is much younger. There's a number of takeaways on the table. We just had an action at the hospital today. NUHW, the NUHW, the other union there that represents a lot of other workers there, their whole union would be merged into AFSCME, and then the lab techs too would be merged into a new union. It's going to affect all of us, and it's going to have an impact on the hospital and the care that the patients receive. Because if longtime workers don't stay at the hospital, it really changes the culture. And we have people, like I've been there almost 38 years, Martha was there 40. It's like it has an impact on people if the working conditions, the fact that our schedules, there's a lot of 12-hour shifts at UC. We have 8-hour shifts. It's like changing the culture. Me, as a resident of California, it's a public institution, and I find it kind of strange that the UC system is an insurer, a health insurer, in the business of providing health care, and it's not just teaching. Like, it is a teaching hospital, but now they're also an insurer. So they're making decisions, they're buying up hospitals, they're making decisions that's going to affect patient care and workers based on a bottom line.
Hey, what is May Day? International Workers' Day, that's right. My name again is Nikki Fortunato Bass. I've lived here in Oakland for about 27 years, and I am so proud to represent you today as your supervisor on the Alameda County Board of Supervisors. Do you hear all that noise? That is for you. That noise is for you. So we are here today at Children's Hospital. This is a beloved hospital because we know this is the place where if your child has an emergency, if your child is in trauma, this is where your child can go for care. And who gives that care? Why is this such an amazing hospital? It's because of all of you, right? We know this International Workers' Day, we are able to provide the care that our children, our families need because of our frontline nurses, frontline staff, all of you. But there's something that's really concerning to us today, and that's why we're all here. And that is the integration plan with UCSF, right? And so I've had the privilege of working with all of you, with listening to you. And I'm very concerned about this integration plan. It means that you all who provide care for our children, you may lose some of your pay. You may lose some of your retirement. You might even lose your union. And what do we think of that? And so as your supervisor, I have reached out to the leadership of CHO to ask these questions, ask for answers, and to make sure you are able to negotiate directly for the rights, the benefit, and the dignity that you all deserve. And I also want to note that we're all in this together. All of us were a part of working to pass Measure C, right? Measure C supports early childhood education. It supports children's health care. We know that with the money that UCSF Children's Hospital will get, we have to support staffing, right? Full staffing to serve our kids. We have to support training. We have to support new equipment. And at the end of the day, not just today on May Day, every single day, let's make sure that all of you have the dignity, the respect, and the fair contract that you all deserve. Thank you so much for all of your work. Thank you, Supervisor.
This short because the voices that matter aren't those of us in the elected office. The voices that matter are all out here wearing red and holding signs, because the work you do is integral for Oakland. There is nothing more central to Oakland than Children's Hospital. And before I was a politician, I was a union president. I was the president of the Firefighters Union. And there's something that we have in common with you, and that is when we're negotiating, we're not just negotiating for ourselves. We're out there negotiating for the people of Oakland. You guys are here because you care about our children. You care about the ratios. You care about the service. You care about the kind of care that our children are getting. And I want to thank you personally because, like Adrian said, all three of my kids have been here many, many times, and you have all taken amazing care of our children. And you deserve to be taken care of as well. So it's important that we make sure that your voices are heard, that your rights are heard, and you get to keep doing what you do, which is taking care of our children, taking care of our city, and you deserve to be taken care of. So thank you. Let's get out there and raise those signs and raise some hell.